Pressure ulcers. A pressure ulcer is a localized injury to the skin and or underlying tissue, usually over a bony prominence, as a result of pressure or pressure in combination with shear and or friction. The rate of pressure ulcers. In an inpatient department, the rate of pressure ulcers is 3.5% to 69%. In a long-term care facility, the rate of pressure ulcers is 2.2% to 23.9%. In an in-home care facility, the rate of pressure ulcers is 0 to 17%. In a spinal cord patient, 30% to 85% have pressure ulcers. Pressure ulcers are the most costly and physically debilitating complications in the 20th century. Pressure ulcers are the third most expensive disorder after cancer and cardiovascular disease. Pressure ulcers have a high mortality rate. 22% mortality was reported following 23 patients over 6 years. That means out of 23 patients in a 6-year span of having a pressure ulcer, 22% of those patients passed. Clinical Guideline Article 1. Dutton, Sherrill, and Curtis created a study based on the research question, what is the state of the knowledge in relation to the context of practice scope of practice and impact of the wound care nurse? So this article has a research design of an integrative review design, targets the population of registered nurses focusing on wound care, and uses the measurement tool of a multi-method search strategy to perform the study. The findings from the article are as follows. The study describes the context of practice, scope of practice, and impact of wound care nurses. There is some evidence that nurses improved healing times and decreased pressure injury prevalences. There is also a little consensus on the level of competence and educational requirements and qualifications required to work as a wound care nurse. So that could be a lack in the study. They need to know exactly what a nurse needs to be required to do to work as a wound care nurse. The Clinical Guideline Article 2, written by Van Heck, Beckman, Kripnak, Moluter, Henner, and Vedgaj, created a study based on the research question, what effect does knowledge deficits have on a patient with leg ulcers? So Article 2, they used a research design of a qualitative design based on grounded theory methods with constant comparison. The target population was patients with venous leg ulcers, and they used the measurement tool of a semi-structured interviews. So the findings from the Article 2 are as follows. Patients with leg ulcers often have inadequate knowledge of their condition. They need greater knowledge about their condition before they can understand treatment and promote healing. Two major themes that came from the data analysis are the knowledge and information deficits. So patients have a deficit knowledge in their condition of leg ulcers and pressure ulcers. So if nurses can gain more knowledge on pressure ulcers and leg ulcers, they can teach their patients and the patients will gain more knowledge. So the second theme is VLU perceptions and their consequences for information-seeking behavior. So what we plan to change with this EBP is the rate of pressure ulcers on a medical surgical unit. If the rate of pressure ulcers on a medical surgical unit are not changed, a patient will have a prolonged hospital stay. So instead of only staying a week or so, they could stay up to a month, and that can end up being costly for the patients and insufficient for the nurses in the hospital as well. If the rate is not changed of pressure ulcers, the pressure injuries won't heal properly. So prolonged healing leads to improper healing. And prolonged healing of pressure ulcers can also lead to infections, and infections can lead to patients being severely ill. So the PICOT question that this study will be based on is, among medical surgical registered nurses, what is the impact of a nursing education program on pressure ulcer rates over a 90-day period? So linking this question to the current research and current workforce, currently in facilities such as ECMC, nurses are given informational papers on pressure ulcers, and they also are required to do an online video that has post-test questions at the end. However, the study we will be creating will be different than the study at hand because an educational program will be offered to medical surgical nurses as well as monthly staff meetings, and currently this educational program is not available to nurses. So the methodology for this study will be a quantitative study. We will use pre-test and post-test with quantitative questions using the Likert scale of nurses' knowledge of pressure ulcers. The number of pressure ulcers will be reported at day 1, day 30, day 60, and day 90. The design we will use for the study is a correlation design. A correlation design examines the relationship between two or more variables within a situation without knowing the reason for the relationship. So this design is trying to establish a relationship between the intervention and the dependent variable. The variables in the study are as follows. The independent variable is an educational program on pressure ulcers, and the dependent variable is the rate of pressure ulcers on a medical surgical unit. The population we will focus on is registered nurses working on a medical surgical unit, as well as the pressure ulcer patients on that same medical surgical unit. A sample method that we will use for this study is convenience sampling. Convenience sampling is the process of selecting elements to be in the sample simply because they are readily available. Therefore, we will choose registered nurses based on them working on the unit that we are doing the sample on, so they will be right there ready to volunteer and be ready for our access. The sample size will be based on the rule of 30s, so there should be 30 subjects for each group of a variable according to the rule of 30. Therefore, we will need 30 nurses to participate in the study. The data analysis method we will use is the descriptive statistics to measure the rates of pressure ulcers. We will use the central tendency method, which is to allow researchers to show the audience how the scores are distributed around a central point. So the mean is going to be the average number, the median is the middle number, and the mode is the most frequent number. These numbers will represent the number of pressure ulcers on the unit. What do we need to implement this study? We will need a wound care specialist to come in to teach the 2-week program to the RNs on the unit. We will need a medical surgical unit to participate in the study. It will be consistent of teaching in a hospital, and the educational program will be a 2 or 3 hour class that will be taught twice a week for 2 weeks. The risk and benefits of the EBP that is at hand. The benefits are nurses gaining more knowledge of pressure ulcers, and another benefit is a decreased rate of pressure ulcers. However, there are risks. Spending money to run the program and not gaining anything from the program. Money doesn't come from trees, so it is going to be something that needs to happen for this program. We will evaluate this study to know if it is working, if nurses report having more knowledge on pressure ulcers, and if the rate of pressure ulcers / injuries decrease over the 90-day period that we are evaluating through. We will integrate and maintain this EBP on all new RNs will be required to take the educational program on pressure ulcers during their orientation. Annual training will be conducted to make sure the registered nurses are up to date on pressure ulcer training, and it will also be added to the hospital's protocol. Staff meetings will be conducted once a month to report the number of pressure ulcers on the unit. If there is a decrease in the reported number of pressure ulcers, then the educational program is helping. So tracking the change, results will come from the number of pressure ulcers reported over a 90-day period. Monitoring for a total of 90 days after the educational program training is completed, and the number of pressure ulcers on the unit will be reported at day 1, day 30, day 60, and day 90, and that will be a quality improvement tracking. So from day 1 to day 90, we can see if the rate of pressure ulcers has improved in quality and decreased in number.